Good morning. Welcome to the Survivorship Oncology Clinic series. Today we have Kathy Martin with us. She is a pediatric nurse practitioner with Levine Children's Cancer and Blood Disorders Clinic. Kathy works with our clinic along with Dr. Jennifer Pope to help us transition adolescent cancer patients into our adult survivorship program. Good morning, Kathy. Can you tell us a little bit about yourself?
Good morning, and thank you for inviting me. My name is Kathy. I am a nurse practitioner, and I've been with Atrium Health for 30 years now. I've always worked in pediatric oncology programs, starting out as a nurse educator, nurse coordinator. And I took the opportunity to grow with the program and decided to go back to school in the late 90s and became a nurse practitioner. I've had various roles within our program, most recently serving on the solid tumor program as the nurse practitioner. It sort of became a natural progression for me to want to work in the survivorship program, and the opportunity came up. And so here I am, along with Dr. Pope, running the survivorship program.
Great. We are so happy to have you helping us transition these patients that are adolescents that are now ready for an adult survivorship surveillance. Can you just give us an overview of just what is the Adolescent Survivorship Cancer Clinic?
So this program we developed in collaboration with our adult colleagues to really help ease the transition of childhood cancer survivors into the adult survivorship world. So we know that almost all childhood cancer survivors are at risk for at least one significant late effect. These late effects, they really begin to emerge in early adulthood. So if they're recognized early on, then the patient outcomes are going to be much improved. So this program really gives our patients the opportunity to maintain continuity with a provider who is up to date on the pediatric oncology survivorship guidelines.
Yes, this is just so important, and we're just so excited to have your collaboration. Can you tell us, when do you know when one of your patients is ready to transition to our adult program?
That is a great question, and this is sort of where the factual parts of medicine and the art of medicine truly merge. So for example, the facts are the patient must be 18 years of age. That's the legal adult age. They need to be 5 years from diagnosis and not under any current surveillance for their disease. So we mix those facts with a true feeling or an art that our patients are ready. For example, have they settled into an independent life? Are they self-advocating? Do they have a good understanding of their health history and an awareness of their potential late effects? We take all that into consideration. So if you think about it, not all 20-year-olds are the same.
Definitely true. Can you give just one example, no names of course, but of a patient that benefited greatly from this transition?
So, yes, there's tons. But just yesterday, I saw a young lady who's in her early 20s, and she's a survivor of ALL. So I knew her from diagnosis at the age of 7. Last year's visit, she just wasn't quite ready to transition, even though she was of age and she met all the other factual criteria. She had just graduated from college. She was trying to figure out where to live, what jobs to seek, and one more change for her was just one too many. So she asked for an additional year with her pediatric team. This year, just yesterday, it was enlightening. She was settling into a committed relationship. She was starting a new job. She was moving out of her parents' home and into her own place. And she recognized how anxiety-provoking all of these things have been over the past year, all of these new life changes. And she asked for a referral for counseling. That's huge to me. She was really self-advocating. I knew that my role with her and her life was complete. So we discussed the transition, and she clearly stated, "I'm ready." So she crossed that bridge yesterday, and I'm confident, and she is confident, that she's going to be in the care of a provider who understands childhood cancer and is really better suited to care for the adult issues that may emerge.
Wow, that's just an amazing story, and I'm sure there's more than just that one. And like this just brings me to the next question about, what is the most rewarding part of this clinic besides that amazing feeling that you've really done an amazing job with this patient?
So truly, it's full circle. It really is the ultimate honor to be able to witness and be a part of these once tiny humans who were very sick, to help see them through their treatment, to help see them through their early survivorship years, to help them understand where they've been, and help them to learn to be their own best advocate, and now hand them off to an expert. That's excellent care, and that's icing on the cake for me. It really doesn't get any better than that from a professional standpoint.
Yeah, I can see it can be really emotionally involved as well, because you've been a part of their lives for so long, and to see them survive cancer and then move on and be that young adult that you have wished for them to be all these years. So what would be the takeaway for the people viewing today? They may be going through cancer themselves, or their family member or loved one or friend. What's the takeaway that you would like for folks to get from this YouTube video?
That's a great question. I think the takeaway is that our coworkers, our colleagues, our community, and mostly our patients to know that if they are diagnosed with childhood cancer, they have the opportunity right here within Atrium to have expert care throughout the continuum of their cancer journey, from diagnosis to treatment to follow-up to survivorship, and then to adult survivorship.
Yeah, that's great. That's really great. And we are just so fortunate to have the folks at Levine Children's Cancer and Blood Disorders Clinic, and Kathy Martin and her colleague Dr. Jennifer Pope, to help us learn about their patients and how what they've been through, and then transition them into the Survivorship Oncology Clinic. But just to let you know too that our Survivorship Oncology Clinic for adults is not just for patients at Levine. If you have moved to the Charlotte area and you have had a history of childhood cancer, then you can have an appointment with our Survivorship Clinic. You can call the number here at that is included here in this link, and we can make an appointment and see you, and also do everything that she is describing as far as surveillance for you. So we thank you so much, Kathy, for coming today and for letting us know about your role. And next month, we are going to be talking to her colleague, Dr. Reposardo, who then takes the patients that Kathy refers and follows them throughout their adult journey. So thank you so much, Kathy.
Thank you.
I wish you a lot of luck in your future endeavors.
Thank you so much.
Thanks for watching. For more information, visit us online, send us an email, or give us a call. Don't forget to click subscribe and hit that notification bell so you know when new videos are released. And most of all, be well.